Hi, I'm Ann Klauka, the registered dietitian with the Real Health Network, and today we are here with Chuck Wooliver, who is the founder and executive director of Walk for the Beat, which is a great local not-for-profit organization that is geared toward bringing awareness as well as combating heart disease. And it's so awesome to have you here with us today, Chuck. Thank you for joining us and to tell your story about this.
Thank you. It's an important story. Well, Ann, in 2015 I was diagnosed with peripheral artery disease. I'd never heard of it up till that point. What it is, it's a blockage of the arteries to the legs. And I was completely 100% blocked. And what was happening was I was getting cramping in my lower legs and my calf muscles. I would walk maybe a half a mile or so on the treadmill and they would start to cramp up. Well, over time, that distance that I could walk before the cramping happened became less and less. So when my cramping got so severe, I went and sought out medical attention. Fortunately, ended up with the right cardiologist, Dr. Kazia from Crittenton in Ascension Health. And he said that had nothing happened, had I not been diagnosed, that it would have led to sudden death.
So what kind of treatment did you have to go through?
Well, I had 5 procedures in 2015 to clear those arteries. And what they do is they put stents in the arteries to repair the blood flow. And so I had 7 stents and I had 2 complications. So I was in the hospital 7 times in 2015 and I had a pretty rough go of it.
Wow. Well, we're happy that you're here.
Thank you. Me too.
Now, you went through an awful lot so far with this, and I know you're going to be doing a few things that are very educational for us as far as walking across America.
Yeah. Since Dr. Kazia, he leaned over me on the operating table after fixing my heart artery and said I was a very lucky man. So after I initially saw my wife and cried for about 30 minutes, realizing how lucky I was, it dawned on me that I really wanted to do something to give back to the heart community. I'm in my mid-50s now, and I felt, now's the time. I can get out of corporate America and do something good for people that are heading down the path that I'm heading down, which is perhaps they have coronary artery disease and they don't even realize it.
So really bringing that awareness is the name of the game.
Awareness is important, and I think awareness has already happened. I think what the next step is getting people to take action, and that's where we come in. So the walk is really to motivate and inspire other people to get out, to get active, to eat right, lead a heart-healthy lifestyle.
Yeah.
That's the goal.
And I can't wait to follow you through this journey because, I know this, it's going to take a lot of training, it's going to take a lot of fitness and nutrition.
Yes.
It's a different type of routine that you're going to be following.
Right, and I've always been active my entire life. But what I did just recently was I became a certified personal trainer. So I learned more about what it's going to take to walk across the country. I have no idea what kind of toll that's going to take on my body. I plan on walking 20 miles a day, 5 days a week.
Wow. Now, how long is this going to take?
About 6 months.
6 months?
Yeah, 6 months.
So we have a good journey ahead of us there.
Yes.
And we're really looking forward to future segments with you, talking about your fitness and nutrition, not only for your training, but also for heart health.
Sure.
It's all about education. It's all about, again, awareness, of course, and being proactive in that.
Right, and I think what people miss is as we age, I said I was 55, your muscles, you lose a little bit of muscle tone every year. And what does that mean for daily activities, getting in and out of a car, reaching for something on a shelf, right?
Yeah.
Could you hurt yourself? Yes, you could. And then how quickly do you recover? So being in shape and exercising and doing the right exercises at the appropriate age, right? I'm not talking about lifting 400 pounds.
Right.
And staying in shape will lead to a healthier lifestyle.
Right. So thank you so much for sharing your story, Chuck. It's been great hearing it, and I love what you're doing with this. So we can really follow along. The viewers can follow along through
our web page, which is walkforthebeat.org.
Okay.
And online on Facebook. Walk for the Beat is our page. Or you can come walk with us.
Awesome.
It's only 3,000 miles.
It's only 3,000 miles. But we can really follow along your whole journey and also get some good nutrition and exercise tips by checking into Real Health Network. We're going to have some future segments on Chuck and on some of the things that you're doing and just some great ways to stay healthy, heart healthy especially. And so check us out. Check us out again on Real Health Network. Thank you so much for watching and tuning in again. Thanks.